Wonderful. Thank you, Jean. Let's start. I want to start by showing this presentation about our clinic. Okay, we're going to discuss egg donation at Vida Fertility, all the costs and all the process explained. As I told you, I'm Saul. I'm the head of the English speaking department at Vida Fertility Institute in Spain. And also, I'm in social media. So you can follow me and Fertility with Saul in Instagram and TikTok for more information and little tips that will help you during your fertility journey. So, who we are? That is the first question when you look for a fertility clinic abroad. So, we are a clinic specialized in fertility treatments for international patients. And one of the highlights of our clinic is that we are focused on personalized care, which is one of the most important aspects from many others that will help you decide what is the best clinic to approach. What are our mission and values? Firstly, we have empathy with our patients. We have all the expertise required as we work with doctors who have been in the field for a long time, not only in Spain, but from all around the world. And of course, our goal is to achieve excellence. The success of our patients is our success. And this is what we look forward since the very beginning of a conversation. So, what we do? Okay, and this is a question that's always asked to clinics. We are able to do every single fertility treatment available in the world. So, the first one, commonly known as IVF, is one of our main treatments. Okay, this along with egg donation, which will be the topic we will focus on today, using sperm donation as well. Fertility preservation as well is done at our clinic, commonly known as egg freezing or social freezing. Then genetic testing for many aspects that we will cover later on, treatment options for single mothers and LGBTQ plus families. And of course, we also have the option of performing regenerative medicine. What is the overview of what we offer? We're experienced specialists trained in cutting edge techniques and committed to innovation, which is one of the key aspects nowadays in fertility. We have tailored treatment plans. And why is this? Because our philosophy is that each patient is completely different. So our doctors take their time to understand each individual case and address every single treatment option that may be favorable to each one of our patients, individually understanding them as a unit. Then we have expertise in remote treatment management. And this is very important when searching for clinics abroad, is the easiness of communication between you, between your coordinators, and between your doctors. Of course, we have a multilingual support to ensure clear communication. We are used to work with countries from all around the world. Not only patients coming from Spain, but patients from the United Kingdom, patients from the United States of America, patients from Europe, France, Germany, Netherlands, and even other places all around the world geography. So we have a team that has been trained to understand different cultures and to speak in your own language so we can help you and you can feel comfortable with our team. So, where are we located? Vida Fertility has two main locations so far. We have our clinic in Madrid, okay, the capital of Spain, and located 20 minutes away from the airport in a very beautiful neighborhood where you can have everything done. In the same day, you can have every treatment done, and you just can fly back home on the same day. And then we have our other location, which we're very proud of, is Alicante. Most of our patients love to come to Spain, not only because the expertise in fertility treatments, but it's because of its beautiful locations. Alicante is also a very convenient area due to its closeness to the beach, due to its fantastic weather, and because it's the center for many, many international tourists and patients to come to Spain to enjoy some holidays and even to start a fertility treatment in a place where they feel comfortable and relaxed. We have accessibility for international patients, of course. So let's go to the main topic that we will discuss today, and this is egg donation. What is an egg donation treatment and who is it for? This treatment is an effective reproduction solution, this is how we call it, that can use the sperm of the partner or sperm of the donor, meaning a double donation, using eggs coming from a donor, okay, that has been proven to have good fertility results, okay, and good number of eggs. This is for women who have several and unsuccessful attempts at IVF, treatments, and repeated miscarriages, sometimes poor ovarian quality, sorry for the typo, at advanced maternal age, or genetic alteration in their eggs. So this is when finding a donor would be the best solution to undergo a treatment and to achieve the results that we expect, having a healthy baby. So what is the difference between undergoing egg donation somewhere else or undergoing egg donation in Spain? Firstly, we need to talk about the legislation. Legislation in Spain is very open for donation treatments. And why is this? Firstly, is because donations are possible and because they are completely anonymous, meaning that it's your doctor, the person who will select your donors based on blood group compatibility and physical characteristics with yourself. The reason of finding a donor is to finding a donor that resembles you so the baby looks like you. And one of the reasons this anonymity is positive for many aspects is because this allows us to have a wide pool of donors available. Anonymity not only protects the donor, but it also protects the patient and the future child, making sure that there will be complete confidentiality with this donation, and the parents and the families will be the ones deciding what to tell their child in the future without any risks of having any kind of communication. Then why Spain is important is because it's the best and longest clinical experience in egg donation treatments worldwide. We have been practicing this kind of treatments in Spain for about 30 years. And of course, this leads us to have experienced clinics and highly skilled professionals specialized in this kind of treatment. So, how we can start an egg donation treatment at Vida Fertility Institute? Firstly, we need to book an online or an on-site initial medical consultation. Then we need our patients to perform all the tests that are indicated by the doctor on this first appointment. What happens is that if you have tests done recently in the last year, or if you have any medical reports from your previous cycles, we will ask you to send us everything in advance. So this way, our doctors can study meticulously your case, and by the time of your consultation, they will be already prepared, and they will be already helping you with what are your specific needs, understanding your case, and building a tailored treatment plan for your case. Then what is important is the matching, okay? We will need now to match the donor with your phenotype. For this aspect, we will send you a physical characteristics form that you will need to fill out with all the information related to your physical characteristics and any other information you would like the doctor to consider during the process of the selection of your donor. It is very important to understand that although these donations are anonymous, our doctors take a very precise note on what is written, on what are your physical characteristics, and we even ask you to send pictures. So this way, the selection is more precise, and we can make sure that we can find the perfect match for you. Then, what is important in case of a couple undergoing treatment and using a partner's sperm, we will need to have the sperm sample of your partner at the clinic. So, for this instance, only one visit will be required. Okay, sometimes one morning visit could be perfectly enough to undergo all the tests at our clinic and to leave the sperm sample that we will test and we will use for the treatments. Then, what we do, once the egg retrieval of the donor takes place, we will fertilize those eggs with the partner's sperm or the donor's sperm, depending on the kind of treatment that's indicated. And we will go to the incubator for 5 days. On day 5, we will achieve embryos at a stage of blastocyst. And blastocyst is the right moment when an embryo can be transferred to make sure that the results are as best as possible and the implantation rate is as high as possible. Once we perform this embryo transfer, 10 days later, you perform the blood pregnancy test and give us the good results. So, I'm going to move forward with the process and what would be the patient journey for a fertility treatment. So, as I discussed before, usually 2 journeys are required. Okay, the first one to leave the sperm sample at the clinic, and the second one for the embryo transfer. And why is this? Because once we have the sperm, we will make everything else. We will find the donor, we will retrieve the eggs, we will fertilize them, and we will have the embryos. At this moment, we can perform the embryo transfer exactly on day 5, or in case that you need to have this transfer done later due to job responsibilities or accommodations on your calendar, we can freeze those embryos and perform the embryo transfer any cycle later. So we can also have the possibility of undergoing only one journey in case the donor and recipient are synchronized. And this journey, okay, will take place also even undergoing a fresh sperm sample by the time of the egg retrieval. So in some cases, we can organize this process to happen in only one visit. Okay, so one of the most frequently asked questions we have is like, who are our donors? And we can say, based on statistics, that Vida Fertility's donors, we have a wide pool of donors. Patients always coming, donors always coming to undergo treatments and to donate their eggs, and because we have our own egg donor department, and 70% from these donors are students. Also, 70% are Spaniards. Okay, the other 30%, although maybe they are not Spaniards, they live in Spain. One of the important things about Spain is this is a very multicultural country. So we have a wide variety of phenotypes available. It's never an issue to find a suitable donor for our patients, considering that all these phenotypes available will help us find a right match. Also, the average age of these donors are from 24 to 25 years old. So, what are the requirements to access the egg donor program? First, we need to determine the ovarian reserve of our donors. Then we will perform general health examination, including blood works, including serologies, and even psychological tests we perform to each one of our donors. And besides that, we perform genetic tests to our donors. Besides the karyotype testing, which makes sure that they have a genetic map, a healthy genetic map, we also perform a carrier panel testing to our donors, having the possibility that when a patient starts a treatment, we can perform a genetic matching to make sure that no carrier conditions match between the partner and the donor, and therefore avoiding the 25% risk of passing this condition to your baby. So we have prepared some frequently asked questions. I'm seeing this chat with many questions starting. I'm going to go one by one with them, but I want to make sure to start with this frequently asked questions to help you understand this process. So what is the typical timeline for an egg donation treatment at Vida Fertility? Okay, I will resume how it looks like since your first consultation. Once you book your first consultation, although it's an online consultation or an on-site consultation, the doctor will tell you which are the tests that you need to undergo to start the process. If you are at our clinics in Vida Fertility, you can have those tests done on the same day, and the results may take no longer than 3 weeks until they are received. If you are in your own country, it will depend on how long it will take for you to undergo the tests indicated by the doctor. Once we have those results and we sign all the necessary documents, okay, to confirm your treatment, the donor selection process will start. Although there are no waiting lists, and this is very important to understand, there are no waiting lists at Vida Fertility. The only time that we will take to wait, it will be the time until the doctor finds the suitable donor. And this timeline can go from 1 to 3 weeks, depending on the phenotype and depending on the availability of these donors. Why? Because the doctor wants to make sure that although the phenotype match, many other aspects and the right donor can start the cycle on time and you can have a perfect match according to the doctor's criteria. Once the donor starts, okay, she will start with her cycle, okay, that will take around 3 weeks until the egg retrieval. And at that time, while this is happening, our patients are undergoing the endometrial preparation to prepare the lining of the uterus to the right thickness before doing the embryo transfer. Once we achieve day 5 and the lining of the endometrium is in the right size, the right thickness, we will perform the embryo transfer. So we're talking about an approximate time of 3 to 4 weeks until the entire process is completed. After the embryo transfer, 10 days later, the blood pregnancy test is done. The beta-HCG test. You can do it in your own country and send us the results, or if you want, you can come to Spain and have the test done here at no cost. Then, what's included in the initial consultation and how should I prepare for it? When you contact us for the first time, and at the end of this presentation, I will give you our contact details so our specialized team can help you with all this information. Once you reach out to us, we will send you 2 forms. One is a data protection form required by law to exchange medical information, and the other one is a medical history form with important information about your family history, about your medical background, if you have any allergies, if you're taking any medication. This, along with the tests that you have already done, will allow the doctor to understand your case thoroughly, study your situation, and by the time of your consultation, give you her best advice based on what she has learned from your medical background. This is how you will need to prepare it. What is included? An exhaustive consultation, a very thorough consultation led by highly skilled professionals at our clinic. Professionals who have been specialized in complex cases for many years and understand and live these procedures every day, understanding the needs of her patients and understanding the human side of this kind of treatments, being very close to the patients and helping them hand by hand until the right moment when the treatment is done. To prepare for it, our recommendation is to prepare as many questions as you have. If you have any questions that you never couldn't clarify with your coordinator because they were more related to the medical expertise, remember to write them down after your first call with the coordinator. This way you will remind them, okay, by the time of your consultation with the doctor, and you will have everything you need. Although, if you forget to ask something, no worries at all. Our team of coordinators will be always available to help you. And once you start your treatment, you will have as many consultations with your doctor as you wish. Our doctors will be ready to help you and to be with you in this important moment. Then, can I have an online consultation if I cannot visit Spain immediately? Absolutely, yes. Online consultations are part of our day-to-day routines, okay? Although I personally believe that an on-site consultation is more close. Why is this? Because you will have the chance to see the clinic, see your facilities, meet the doctor who will be hand by hand with you until the end of the process, meet the entire team of coordinators, and even undergo all the tests that are required only in one visit. However, if you cannot do this on-site visit, an online consultation is perfectly possible. We now live in days where technology help us be together regardless of the distance. And by booking your online consultation, you will be able to have the exact knowledge, the exact feedback, and the exact treat that you will have from the doctor, although you cannot be on site. Then, what is the cost of the different fertility treatments available? This is also a very important question that many people ask. So I will start by saying that we have different programs on egg donation. So we have programs that are tailored to your needs and that guarantee a minimum number of embryos. So why it's important to have a minimum guarantee of embryos? Because you have a backup for many reasons. If you are family planning and you're willing to have more than one child, having more than one embryo will ensure that you can have this possibility. Now, thinking in the worst case scenario that a first attempt doesn't work for any reason, you still have embryos at our bank that can be a backup for a second or third attempt. So the safest way to move forward is achieving as many embryos as possible, and Vida Fertility will provide you with these different programs according to these different guarantees. Our two embryo program starts from 6,700 euros, okay? And it includes, as all other programs, all the medical consultations with your doctor, a medical treatment plan and follow-up. It includes as well everything that's required for the treatment except for medication. Okay, medication is completely apart. You will need to buy the medication in a local pharmacy, or if you come here to Spain, as many patients do, they buy the medication here and they take everything with them so they can start the treatment home with everything that's needed. And sometimes the costs of that medication here in Spain are way lower than many other countries where we work for. So our basic two embryo program starts with 6,700 euros plus some additional features depending on what has been discussed with your doctor. Remember that after your consultation, we will share with you a personalized cost estimate based on the exact requirements and what you have discussed with the doctor to make sure that you don't pay more or less than what is necessary for your treatment. Then we have a program of 3 embryos starting from 7,900 euros, a program of 5 embryos starting from 10,800 euros, and even we have a program of 5 embryos plus pre-genetic testing. Okay, what is pre-genetic testing? Is the process where we perform a biopsy on the embryos before an embryo transfer. Although this is possible in egg donation or in any treatment, the real recommendation of undergoing this PGTA test is when patients are using their own eggs due to the ovarian quality, due to the egg quality that may lead to have aneuploid embryos. In terms of an egg donation treatment, although this is a perfect possible option. Okay, it is not mandatory or strictly indicated, as all our donors are tested genetically, and our patients as well are tested genetically to make sure that there are no big chances of having any issues. Then, well, thank you for so much for your attention. I think I've been speaking for about half an hour. This session lasts 1 hour, but I'm seeing many questions in the chat, and I want to make sure I can answer them individually. So let's begin your journey. Our contact details are here on the screen. You can reach out to us anytime in this email address, contact@vidafertility.com. Our team of coordinators will be available to reply to you in less than 24 hours, book an introductory call, and give you all the information required to book an appointment with one of our doctors. So I'm going with the chat, and thank you for all these questions. I'm going to start with Angela, who's asking, I've read about the artificial intelligence tool called PhenoMatch. Do you use this? Great. This is a fantastic question. And there are many artificial intelligence tools nowadays that can compare robotically a picture with what we have in the system to see if there is a matching. We have used this kind of technology in the past, and we realized that the real matching and the best way to match a patient is having a doctor who knows you doing the selection, is having a personalized approach and a personalized selection. When a donor is selected, our team of doctors, they get together with our egg donation department, and they individually address every single case to make sure that the resemblance has been picked up by a human being, by a doctor that has been hand in hand with you since the very first moment, a doctor who understands your background and who has talked to you personally or virtually. So this way, by having this personal selection, we make sure that the results are as best as possible. Although nowadays there could be technology, we understand that we cannot delegate everything into technology when we talk about science and when we talk about healthcare and personalized treatment. But although there are possibilities like that, our philosophy as a clinic in Vida Fertility is that we have a human approach and a human selection of the donors. Okay, I have a second question. Okay, also from Angela, and thank you, Angela, for your questions. Approximately how long does it take to find a suitable egg donor? Okay, fair hair, fair skin. As I mentioned before, the good thing of Spain and one of the best things of having treatment in this country is that this is a very multicultural place. If you come to Madrid or if you come to Alicante, you will see people from all around the world in the same area. You will see a wide variety of phenotypes, a wide variety of cultures, a wide variety of mixtures. So this allows us that there is no waiting lists in terms of finding a suitable egg donor. So if we want to summarize an approximate timing on how long does it take to find a suitable donor, I would say no more than 3 weeks. Okay, once we know the phenotype of our patient, and once we search in our database of donors, and once we know who could be the suitable donor for a patient, we will be ready to start the cycle of the donor. Okay, so no more than 3 weeks would be my answer. Then I have another question here from Clara. Thank you, Clara, for your question. With egg donation, what percentage chance of achieving pregnancy after transfer we can calculate? Thank you for your question. This is very interesting question to address, because when we talk about egg donation, we talk about, it doesn't matter the age, because our donors are actually very young, okay? And the results are actually very good. When we talk about chances and success rates, we talk about cumulative clinical pregnancy rate. As more embryos, more are the chances of achieving a successful pregnancy. When we work with egg donors that have been undergoing all the necessary tests and all the reviews and all the checkups that are mandatory and that we require as a clinic for them to be allowed to donate, we make sure that their fertility is very high. So, a positive test after a first transfer with egg donation can go over 73%. Now, if we talk about cumulative clinical pregnancy rate, it means that as more transfers, more higher are the chances. So when we talk about cumulative clinical pregnancy rate after 3 attempts, we're talking of over 95% chance of achieving a successful pregnancy. Let's go with another question. Okay, do you have any frozen egg donors? And the answer is yes, we can have the possibility of frozen eggs, okay, at our clinic. And what happens is that sometimes when the patient is not prepared to start the treatment at the moment, but we found the right donor for this patient, what we do is that after the cycle, okay, we can freeze the donor's eggs and fertilize them by the time when the patient is ready. Now, one of the best practices related to this kind of frozen procedures is to already generate the embryos, which has a higher survival rate after thawing. Nowadays, with the techniques that are used in our laboratory, the risks are very low when thawing an egg or thawing an embryo. But when this happens, we also have the possibility of thawing the eggs or thawing the embryos until the time when the patient is prepared to undergo the treatment. Let's say that a patient cannot fly to Spain to have the embryo transfer in the next couple of months. We can have those embryos frozen to be transferred once the patient is ready. Then I have another question from Jira. Okay, I'm interested in donor egg treatment using my partner's sperm. We have high sperm DNA fragmentation issue, but we're not open to donor sperm. What is the best method that your clinic uses to select sperm with high DNA fragmentation? And thank you for this question. This is also very important. When we have our patients coming to our clinic, we perform a full sperm analysis that not only includes a regular spermiogram, but also we perform a Comet DNA fragmentation test to check double strand fragmentation that could lead to infertility. When this happens, there are many ways to improve fragmentation. There are there are treatments with antioxidants recommended by our doctors, okay, like curcumin for 3 months, that could improve this fragmentation. But sometimes, in cases where this fragmentation is uh, severe, we have options at our laboratory to do advanced sperm selection techniques. Okay, there are different names of these advanced sperm selection techniques, but this allows us that by the time of the ICSI, we select the sperms that are not fragmented in double strand of DNA. There are many techniques at our laboratory that are used for this process, okay? And one of the most common is called chip fertile. We do have the possibility of undergoing this at our laboratory, and our doctors will ensure to let you know if this is a requirement to achieve the best results possible. Are you allowed to advise age and nationality of the donor, as I would like to tell my future child? And thank you, Clara, for this question again. So, the anonymity of donations in Spain, according to the law, does not allow us to disclose any other information rather than age and blood group. Why? Because this information will be required for your pregnancy while you are undergoing your pregnancy. but information about nationality cannot be disclosed to our patients. Now, I have another question about the success rates, okay, of our clinic with a donor egg treatment. And I think this is more focused on live births. Um, we have our success rate based on pregnancy, okay, on successful pregnancy after the first trimester. And we can say that a live birth success rate is not fully dependent on the work done at a fertility clinic. Why is this? Because there are many other factors that can lead to not having a live birth that are completely apart from an embryo creation and an embryo transfer. If we talk about habits of patients while carrying pregnancy, a fertility clinic wouldn't be responsible or wouldn't have a direct responsibility on the outcome of this process because it has been fully dependent on the patient at this moment. However, if a pregnancy is undergoing, taking the right health care, taking all the advice from your gynecologists, and taking the right advice from your doctors, the live birth rate would be 80% from the clinical pregnancy rate. Then, you mentioned Spain is multicultural. Do you get donors from Black and mixed race background? Yes, we do. Okay, we have plenty of donors from all around the world, and although they live in Spain or they are Spanish nationals, okay, they can have a family background or a genetic background from many other places. So there are phenotypes, and to be completely honest, that can take a little bit more time until they are found. But we do actually have many patients from different races available as donors. Do you pay your egg donors? If so, how much? Okay, David, thank you for your questions. This is something that most clinics do, and it's not directly a payment, it's a compensation for time. Please remember that undergoing a donation treatment requires a lot of time from the patient. It requires a lot of time out of work or out of the university to go to the clinic and undergoing this kind of process. So, what we do at the clinic is compensating the donors fairly for the time they are spending, okay, undergoing these donations for to benefit or to help other patients who are not able to have patients with their own eggs. In terms of payment, I do not have that information as a coordinator. It's something that's related to the donor egg department. But our donors mostly come to our clinic with a very altruistic will of donating and helping patients, like many patients who are in this conference who are not able to have a baby using their own eggs. In the UK, you buy quantity of eggs. It is not the same in Spain. Do you just pay for the number of embryo guarantees? Does this mean doctors use several donors if don't obtain number of blastos required? Is the preference for fresh transfers? Okay, thank you for this question as well, Jane. Here, as I mentioned before, what we offer is guarantees of embryos, and our clinic will do everything to achieve the minimum number of embryos that are required. Sometimes, if a donor is not able to produce the minimum number of eggs to achieve the embryos that we are guaranteeing to you, our clinic will make sure to find a suitable donor that can achieve that number of embryos. However, that case is very rare. It's something that it's not common. Why? Because our donors have passed through a very exhaustive process, and we make sure that our donors are young enough to have enough number of eggs to provide and guarantee our patients the minimum number of embryos achieved. Then, is the preference for fresh transfers? Yes, we have the preference of fresh transfers. Depending on many aspects, okay? If a patient is undergoing a pre-genetic testing for aneuploidies or a PGTM in case of, important advice, which would not be the case for donation, but in case a patient is willing to do the PGTA, we will need to freeze the embryo while we wait for the results of the genetic tests. Please remember that each genetic test takes around 20 days until we know the results. So in those cases, okay, we will opt for frozen transfers, but always our goal is to have fresh transfers on day 5. Naka, hi, I'm sorry, listen here. I am 49, turning 50 in June. In regard to my age, am I eligible to undergo egg donation at Vida? Naka, what happens is that the limit age to undergo treatment is established at 50 years old. And although this is not something legally indicated, okay, the protocols of each clinic can decide what is the limit to start a process with a patient. We have started processes with patients on your age, and we have achieved very good successful results. So what is my recommendation is for you to book an appointment with a doctor, okay, now that you are 49 years old, so the doctor can address your case individually and she can help you with the following steps. Okay, if you start a procedure before you turn 50 years old, or if you start with all the process or confirmation, we won't have any issues by helping you undergoing a treatment. So please contact us as soon as possible at contact@vidafertility.com. Then, do you offer surrogacy with donor egg? Carlo, thank you for your question. Surrogacy is not allowed in Spain. CPB, we will be able to access this recorded session afterwards. Yes, you will. Okay, our team from IVF Answers and the European Fertility Society will record this session, and it will be posted in YouTube, so you can check it anytime in the future. Then I have another question from Naka. Okay, when opting for one of your egg donation packages, in example, 2 embryos, does a guaranteed number of embryos actually mean it's the minimal number of embryos we may expect, so we receive 2 or more embryos? Or is it rather the exact number of embryos we will receive? So we receive 2 embryos, not more, not less. Thank you. Naka, when we talk about minimum number of embryo guarantees, we talk about the minimum number that our clinic, okay, will ensure you will have. Now, if after the fertilization, after acquiring a package of 2, you obtain 3 or 4, those embryos, of course, will belong to you. Okay, so we won't charge any more for any additional embryo obtained after a package. This is a minimum guarantee that will ensure that you will have this minimum number of embryos. So, Kimera is also writing to us a question saying, can I choose to undergo embryo donation as a single mother, even if I'm married? Do we have some legal responsibility in this case? Okay, so as mentioned before, each case needs to be addressed individually. Okay, embryo donation is a possibility in the same way as single embryo creation. Okay, meaning that we can also create one single embryo for you from a donor, from a sperm donor, and from an egg donor. Okay, then even if you're married, the issue is that if you decide to undergo this process and you are married, if you both, you and your partner, signed the informed consents accepting this treatment to happen, it wouldn't be a problem at all. Okay, you and your partner will take full responsibility of that treatment and that child. Do you have embryo adoption program? Yes, we do have embryo adoption programs, and this will depend on the availability of embryos that were created from previous treatments. Normally, what we recommend our patients is to have a treatment where we create one embryo for them. But in case that there are available embryos that can match the criteria of our legislation, saying that the phenotype resembles the carrier mother, we also have that option. And then I have, I think, her last question here. No, it's not the last. What if I have my own surrogate to have treatment? Okay, this is something actually really important. When you have a treatment done with us, okay, in Spain, when you declare that you're having this treatment to have a surrogacy procedure, this is a declaration that it will be used for something that it's not legal. Okay, so there are many countries where surrogacy is a possibility, and also donation treatments are possible. Then I have another question from Sylvia. It is much harder to conceive a baby with donor embryo when I'm in menopause. I would have to go under more invasive hormonal treatment before the transfer. Okay, so Sylvia, regardless of you having menopause, okay, having a donation treatment, it's not an issue if you have menopause. You can perfectly have an embryo transfer, and you will need an endometrial preparation with hormones. Okay, it's common preparation done with estrogens and progesterone to make sure that the lining of your endometrium is thick enough to receive an embryo or to have an embryo transfer. But having menopause is not an issue when having an egg donation treatment. You can perfectly undergo a treatment. David, thank you for your comment. This was a very clear and precise webinar. I would like to thank you for allowing me to attend. Thank you for attending, David. Thank you, all the rest of the participants who have been here. So I will be always available for any further questions you may have. You have our contact details for anything you will need. So I have another question here. What's the estimated cost of embryo adoption program? Okay, this will depend on the availability. Okay, we're talking around 2,000 euros. Okay, a treatment with embryo adoption. But as I mentioned, the availability of this treatment will be depending on the embryos that we have available. I recommend you to contact us so we can tell you what is our current situation and how we can provide you with a personalized treatment protocol. Jane, is there a cap on how often donors can donate? And does Vida look at donors' previous results if donated at other clinics? Yes, and thank you for this question. It is very important. According to the legislation, there can only be 6 live births for every donor. Okay, so what happens? There is a national registration entity in Spain called the CIRA. So every time a donor undergoes a donation process, this needs to be registered in this entity called CIRA that's ruled by the Spanish government. So when a donor has achieved the maximum limit of live births after donations, they are not allowed to donate anymore. Then, thank you so much, Jane. Thank you for your questions. CBB, thank you for this session. Carlo, thank you for this session. Well, if there are any other questions, I think someone else is writing, so I'll wait to see if there is a question. Yeah, does the online consultation cost and how much? Thank you for this question as well. Yes, the online consultation has a cost. It's a cost of 90 euros that will be discounted from the total cost of your treatment once confirmed. Okay, this payment can be done by bank transfer or by credit card. We will provide you with the link, the secure payment link, so you can have this done and from your home. Then, What is the maximum live birth for donor? Amal, thank you for your question. I think I have already replied it. It's 6 live births per donor. Thank you. So, well, I think time has passed by really quick. It has been a great conference. It has been a great webinar. I'm really glad to be here assisting you. Please remember, you can reach out to us anytime at the email address that you're seeing in our presentation, contact@vidafertility.com. We will be very happy to see you here in Madrid, where I'm based, and in Alicante, where we have a spectacular clinic also with wonderful doctors waiting for you and an amazing team of coordinators. Thank you for this session, guys. It has been a great pleasure seeing you all. Thank you, my IVF answers. Thank you to the European Fertility Society. And thank you, everyone who has joined and the people who has made this possible. I will remain available for anything you may need, and I hope to see you very, very soon. In a very short time, we will be hosting webinars by our doctors, so you can have the chance of meeting them in webinars. And also, we will be explaining different important topics that will be helpful for you during your fertility journey. Remember to follow me on social network, Fertility with Saul, in Instagram and in TikTok. I hope to see you very, very soon, and thank you for attending this webinar. See you soon in Spain. Bye-bye.